Good day, everyone. Um, Maybe morning, afternoon, or evening, depending on where you are. I'll be presenting age cohort screening for hepatocellular carcinoma in African population. It was the result of a study we conducted here in Jos. This was done as a team. I'm only the presenting author. There were several other team members who played various roles. We have nothing to disclose. I'll go through it in this format. As a background, we know that hepatocellular carcinoma is a disease of global significance. The figures associated with this cancer are by no means complementary. It's the sixth most common cancer worldwide, but the third leading cause of cancer-related death, and it's second only to pancreatic cancer in terms of lethality. Here in Africa, it's the fourth most common cancer, and sub-Saharan Africa is particularly a hotbed for hepatocellular carcinoma because of the high prevalence of the risk factors, chief of which are hepatitis B and C, aside the others like the aflatoxins and alcohol. And then the late presentation of patients in Africa is also an issue that comes with patients presenting late, and so they come with late stages when the care is basically palliative, so prognosis is bad here generally. So it means that early diagnosis here in Africa is crucial, and this forms the basis for screening and surveillance programs. We had noticed from preliminary data here that there was a clustering of hepatocellular carcinoma from hepatitis B and C in certain age groups. And so this was the basis for the study we undertook. Now, the objective of this study was actually to demonstrate the clustering of hepatocellular carcinoma from these viral etiologies in certain birth cohorts or age groups. It was a retrospective hospital-based study in which records of 425 adult patients who had triphasic CT-confirmed hepatocellular carcinoma were studied, covering the period 2013 to 2019. Most of the patients were males, and this is also, we saw that the overall mean age was 48.87. The mean age for patients was significantly lower in those who had hepatitis B compared to those who had hepatitis C. Now, this bar chart showed those who had hepatocellular carcinoma from hepatitis B. And we can see here that most of the patients were in the 31 to 40-year age group, and then followed by 41 to 50-year age group. So 31 to 50 was a cluster of patients who had hepatocellular carcinoma from hepatitis B. Now, if we look at this slide showing those who had HCC from hepatitis C, it was an older population. Most of them were in the 51 to 60-year age group, and then followed by the 41 to 50-year age group, and then the 61 to 70-year age group. So combining will be 41 to 70 years for those who had HCC from hepatitis C. Now, combining both of them, 69% of the patients had hepatocellular carcinoma from hepatitis B and C, were in the 31 to 60-year age group. Now, so from the results, we saw that most were males. This is in keeping, our study finding is in keeping what is known about HCC being commoner in males. The mean age of our patients was 49 years. This is a relatively young age. Again, it is known that hepatocellular carcinoma, the mean age of diagnosis in Africa is usually younger compared to other developed nations. And then we saw that there was a clustering of liver cancer in these age groups from hepatitis B, 30 to 50 years, and for hepatitis C, clustered in those between 41 to 70 years. So the clustering of this cancer in these age groups provides an excellent opportunity for age cohort screening. It means that if this is done, it can significantly reduce the stage at which patients present. This was done in the United States. Patients who were born in the baby boom era, that's between 1945 to 1965 birth cohort, had higher prevalences of hepatitis C. And so also from surveillance, were found to have high rates of hepatocellular carcinoma. And so because of the surveillance, they were detected at earlier stages where potentially curative treatments could be done. So in our study, we're able to demonstrate the clustering of liver cancer from hepatitis B and C to certain age groups, with those from hepatitis C in an older age cohort compared to those from hepatitis B. And then an age cohort screening will be feasible in Africa to address the late presentation and diagnosis of HCC here. This would ensure that patients are screened and any HCC detected can be done at least 10 years prior to the age at which these diagnoses were made in the various age groups. So for example, those from hepatitis B, screening can be done pre-college or at undergrad admission. Hepatitis C, pre-employment screenings can help to detect that. And of course, with linkage to care. Now, age cohort screening has been shown to not only be cost effective in other regions, but also to improve survival amongst HCC patients. Thank you for your time. I'll be glad to take any questions you have. Thank you.